How to examine a patient of vertigo?
Do the HINTS Plus testing clinically.
Sir, what's the HINTS Plus?
The HINTS Plus exam is a series of 4 bedside tests: head impulse test, nystagmus, and test of Skew, plus a bedside test for new hearing loss.
Sir can demonstrate all 4 comprehensively?
Why not?
Thank you, sir.
Examine the patient first for spontaneous or gaze-evoked nystagmus and note the direction and type. If there is nystagmus, then do HINTS testing.
That's what I want to know.
In vestibular neuritis, the fast component of the nystagmus does not change direction when gazing left and right. In central causes of nystagmus, the direction of the nystagmus may change direction depending on the direction of gaze. Bidirectional nystagmus.
Sorry? What does this mean?
When the patient looks to the left, the fast component of the nystagmus is to the left, and when looking to the right, the fast component is to the right.
Is this always present?
Although this is not always seen in central causes of vertigo, it is a highly specific sign for central vertigo.
Okay, sir.
Second is test of Skew, which is accomplished by the cover-uncover test. While the patient looks at the examiner's nose, the examiner covers one eye and then covers the other eye. Any vertical or diagonally upward or downward movement of the eyes as they are uncovered indicates a central cause of vertigo.
Very nice.
Third, the head impulse test is used to demonstrate an abnormal vestibulo-ocular reflex on the side of the affected ear, a finding in patients with vestibular neuritis. To perform a head impulse test, hold the patient's head gently but firmly. Ask the patient to look at the examiner's nose and gently move the head left and right around 20 degrees from the midline. The patient should be sufficiently relaxed so that the examiner can then move the patient's head from 20 degrees left or right of the midline quickly back to the midline. This should be done in a random fashion so that the patient does not anticipate in which direction the quick movement will occur.
What's the interpretation of this head impulse test?
In normal subjects, the eyes remain fixated on the examiner's nose, indicating an intact vestibulo-ocular reflex. In patients with vestibular neuritis, when the head is moved quickly toward the affected ear, spontaneous nystagmus is in the direction of the unaffected ear, the eyes will move with the head and thus overshoot the target, the examiner's nose. The examiner sees a catch-up saccade in the same direction as the spontaneous nystagmus that is noticeably larger in amplitude.
What is result of this test in central lesion?
Hit normal in central lesion.
Very impressive.
Check for acute hearing loss by rubbing thumb and fingers together just lateral to the patient's left and right ear and asking whether the patient can hear it. New hearing loss is suggestive of a central cause.